Hi friends, Namaskar. So I'm Dr. Sunil Richardson, a maxillofacial and a craniomaxillofacial surgeon, and I'm practicing mostly out of this South Indian city called as Nagercoil. Today I'm going to be talking to you all about obstructive sleep apnea and jaw surgery. Why the two of them together is because jaw surgery, or in precise maxillomandibular advancement, a type of bimaxillary surgery, is the best answer for obstructive sleep apnea. Okay, so what is this obstructive sleep apnea? Obstruction is because there is an obstruction, so we call it obstructive sleep apnea. Sleep apnea in the sense the patient is not able to sleep very nicely during the night because of an obstruction in the upper airway. This obstruction could be in the nasal area, could be in the oral or behind the oral. So that area together forms obstructive sleep apnea. Now, obstructive sleep apnea per se can be mild, moderate or severe, and the treatment options not only depend on the severity but also depends on where the issue lies. One of the very common problems that patients are having is snoring. So a lot of patients who have severe snoring also have issues working in the daytime because they don't have proper deep sleep during night. And these patients are also possibly having what is called as an obstructive sleep apnea. Now, before we jump into the solution for obstructive sleep apnea, I'm going to try and tell you how we solve this. Now, this is a multidisciplinary effort, and here at Richardsons, me, my ENT surgeon, a chest physician also comes in at times because we got to know where exactly the problem lies. One of the first and the basic investigation that you would want to do is called as the polysomnography, wherein the patient lies overnight in the room, either in the hospital or in his own house, with a lot of leads, which basically give us an idea, a precise idea about what's happening when he's sleeping. So if it's a moderate or a severe obstructive sleep apnea, we also have more investigations to be done. We could go in and do an MRI dynamic sleep study. The patient are also investigated to know the level of the obstruction. For example, you could have a very large overhanging soft palate and uvula combined with a deviated nasal septum and a turbinate hypertrophy that's causing obstructive sleep apnea to a great extent. On the other hand, a lot of severe obstructive apneas are because of less airway space. Now, what do you mean by this? Airway is the space that we have behind the mouth, especially when I'm swallowing. The same passage is used both by food and also by air. This airway is very, very essential for us to make sure the patient doesn't have snoring or the patient doesn't have an obstructive apnea. So that's where jaw surgery exactly comes in. What does jaw surgery exactly do is jaw surgery brings the lower jaw forward, both here in the ramus, it can also bring it forward near the chin, and at the same time bring the upper jaw forwards and downwards as well. You could get the posterior part of the maxilla down, which by saying that it's an anti-clockwise movement, or you can also do a clockwise movement. So those are getting too much into the details of the precise jaw surgery that we need to do to solve a particular patient's problem. But I'm going to just give you an overview right now to say why jaw surgery is the absolute cure, is the best modus operandi for patients who have severe OSA. The other options, for example, a CPAP machine is very difficult for patient to live with. Yes, diet helps, exercise helps, and if a patient is overweight, if he loses 10% of his body weight, Absolutely, that helps with obstructive sleep apnea. But what if all of this has been done? Did you also know that if you sleep on the left side, the chances for apnea are lesser than if you sleep, for example, on your back or on the right side? Well, these are all small points that help in reducing the apneic bouts that the patient is going to have. But there are a lot of patients who've made these changes, who are doing a lot of exercise, who have a very healthy lifestyle, but because of the wrong or improper positioning of their jaws are unable to breathe well, are having obstructive sleep apnea. That's when we come in, that's when we give them the solution that is for permanent, that's for life, and solution that is not just changing their life, but even changes the way they look. And when I say that, I'm saying it for the better. Right. So what exactly are these jaw surgeries? One of the simplest of jaw surgeries that can be done for mild patients is what we call a variety or a type of genioplasty, which is referred to technically as mortise and tenon type of genioplasty. What is genioplasty? We bring the chin forward. What happens when we bring the chin forward? The muscular attachment also brings with it the tongue forward, and therefore prevents the tongue from falling back when patients are sleeping, and therefore indirectly helps in the improvement of the sleep apneic bouts. That's a simple osteotomy, but a more definitive treatment is what we call as a maxillomandibular advancement. I did touch upon this a little bit earlier, but to tell you what it means, a maxilla is the upper jaw. We are concerned about the space of air or the airway behind the upper jaw. So we would want to move the upper jaw in such a way to improve the space behind. I hope you're getting me. And when you do that, you also got to move the lower jaw, because the teeth are there on these jaws and you don't want the patient not to be able to chew food after that. And therefore, when you move the upper jaw forwards, you might also want to move it in this way, which I said was anti-clockwise, or this way, which is clockwise. Most often anti-clockwise helps, but all of these finer decision is made after we have a thorough investigation of the particular patient's anatomy and the physiology and the problem. But in a sense, by moving it forwards, you see, if this is the airway, posterior airway, moving it forward is creating space, and also moving the lower jaw is creating space. And we want to create more space in the hypopharyngeal area, in the posterior airway, which solves the obstructive sleep apnea. And this is in fact the golden standard internationally. It's accepted as a treatment for a lot of these problems patients have because of snoring, because of obstructive sleep apnea. So here at Richardsons, we do a team approach. So sleep study needs to be done. We can also do an MRI sleep study. It takes a couple of days before we have all the data on hand. Cone beam CT scans, all the measurements are done, and then a precise treatment plan is laid down. On some of the patients, I also do what is called as a uvulopalatopharyngoplasty along with the bi-jaw procedures. It's just a uvulopalatopharyngoplasty really doesn't do the job for a lot of patients, because it's only a soft tissue procedure. If there's an indication, yes, it does help. So we here at Richardsons not only do a jaw surgery, I mean what I just mentioned, a maxillomandibular advancement, we also combine it with a septoplasty if need be, and as I mentioned earlier, a uvulopalatopharyngopalpoplasty. So why all of these things are needed to solve a problem is because I mentioned the airway is a complex issue, and the airway depends on all of these factors. So I hope you're able to understand the role of a jaw surgery with obstructive sleep apnea. If you have any queries, if you want to know more about the same, please don't hesitate to ask us your questions. You can either ask us in the comment or you can WhatsApp us, and we're more than happy to give our opinion and to consult you. Thank you. I really hope this was useful.